We're panel one. I am Kathy Grus.
And I'm Lucy McGowan.
Our task was to focus on assessing the interprofessional learner from education to the workplace. And what we did with our first three groups is we had each of the three groups talk about one specific level. So we started with the macro level, then we had a conversation at the institutional level, and then we went down to the micro level. Several things came up consistently across those three groups, many of which you'll see reflected in our overall strategy, but some, just for the sake of conversation, didn't make it in there. We had a robust discussion about data collection and in particular longitudinal data collection and how that could be helpful both with respect to assessing the individual learner, but assessing the educational program as well as for dealing with some of the challenges that we've been talking about with respect to interprofessional education. Another common discussion point was the issue of practice sites and issues that we've talked about a lot over the last day and a half, the interface between the education setting and the practice sites, the types of assessments that are conducted at the practice sites and how we can best enhance what's happening and how we might think about putting more resources to connect the faculty at the program level with the practice sites. Another thread that came up in the conversations was this whole issue of culture and how we really need to ensure that we're building a culture that values interprofessional education before we can get to the next step of talking about how to build high quality assessments of the interprofessional learner. And then the final piece that I think you'll see much more in our recommendations for the strategies is the issue of how do we entice and encourage and promote a culture that really values high quality interprofessional assessment of the learner versus the opportunities that are driven by mandates, if you will, that direct people to things that they have to do to put this in their institution. So I'm going to talk a little bit about our opportunities that we identified at the macro level and then turn it over very quickly to Lucy, who's going to tie that into the strategies that we came up with. As you see here on the screen, we came up with four opportunities at the macro level, again, to address the issue of assessing the interprofessional learner. We had a lot of discussion about the issue of accreditation systems, and that is accreditation not only of the educational programs, but also other entities that look at the performance of healthcare systems and how we might have conversations at the policy level of the importance of interprofessional education and the assessment of the interprofessional learner, and from that direction drive more of a focus on that. We also talked a lot about an opportunity now with healthcare reform and different structures that are being created for delivery of healthcare services as being an ideal opportunity to get more of our interprofessional learners into practice sites in the course. Then we need to develop assessment measures that are appropriate to those contexts that they're functioning in. We also talked about issues related to higher education more broadly, and that might be also an opportunity to advocate at the policy level to promote interprofessional education experiences. And finally, we talked about this is one example of a program here listed, the Magnet program, which I'm not super familiar with, but is a program within nursing that encourages and actually recognizes institutions that are demonstrating interprofessional education and gives them the status once they've met that criteria. So that's what we came up with for that.
All right, I'm going to flip forward a couple slides. You can see we did define a lot of other opportunities at the other levels, and hopefully this overall strategy we felt like it hit mainly on some of those policy opportunities that Kathy talked about. We had a debate about where to start change. There was a consensus that it should be advanced simultaneously at all levels. However, there were so many policy issues. The group thought, it should be advanced at the policy level, specifically with the accreditation issues and tying interprofessional education and practice into the accreditation process for professions and for institutions. Looking for other incentives for system change, like considering what kinds of financing incentives could be there to shift how graduate medical education, nursing education, the other educations take into account interprofessional education. We felt like there needed to be more advocacy for change in those in the funding of training and assessment. There was a consensus that 95% of the clinical workforce is already working. So sea changes in assessment and in interprofessional practice can't just happen in educational institutions. They also need to happen out in practice settings as well. Finally, all health systems users, health systems consumers, need to be brought into the fold, and all levels of stakeholder need to consider how to engage health systems consumers and health systems users as the conversation about collaboration, about interprofessional practice moves forward. Consumers need to be a part of that in order to participate in assessment and shape that moving forward.
Perfect. Thank you both, Kathy and Lucy. And Carol, if you could now focus on the second question and the strategies that emerged around the meso level.